My name is Adrienne Manzanares. I am the Chief Experience Officer at Planned Parenthood of the Rocky Mountains. We are in a critical time right now in terms of the next 4 years for women's access or women's reproductive health. We know for the past 8 years that we've done a tremendous job as a country to reduce the number of unintended pregnancies, particularly around young parents. We've done a phenomenal job of reducing the transmission of STIs. We also know that we have opened up our doors to more and more patients who wouldn't otherwise be able to get their needs met. And we also have seen in some states what happens when those reproductive health issues are taken away. So if we look at places like Texas, where there was a defunding or shutting down of health centers, the maternal mortality rate increased so high. What that means is that women were dying when they were giving birth. That is abhorrible. That is not our country. That is not what we are positioned to be, and that happened in Texas. In Indiana, we saw the transmission of HIV quadruple in one state. We know where we could go, and we know where we've been. So we're at this crux right now in the next 4 years to ensure that we are maintaining the health of our families and our communities. So the national narrative is using this word defunding, which I think is pithy and easy to remember, but it's inaccurate. So Planned Parenthood is not a line item in a federal or state budget. There is no funding that is occurring. Instead, we are able to be reimbursed for the services that we provide, and in particular for the services that we provide to low-income communities. And oftentimes across the country, those are low-income women of color. So if there were any acts in Congress that would take away the ability for a Medicaid patient to choose their provider a trusted provider, someone in their community, that's what we're discussing right now. What we're talking about now is taking away that ability to choose a provider from Medicaid patients. And if that happens, it will be catastrophic. There's no way to overstate this. There are not enough providers in these communities, particularly in rural communities, for these patients to go. So what we're talking about is a public health crisis, particularly in low-income, working-class communities. The fight for reproductive justice right now is critical, and I think that your viewers may benefit from thinking about that term. So reproductive justice is very important, and here at Planned Parenthood we focus instead on reproductive health and reproductive rights. So in terms of reproductive health, that's providing health services to all of our patients across our 4-state region. Reproductive rights refers to the work that we do around advocacy and talking with elected officials. And reproductive justice is an important landscape that is led by women of color whose efforts are to look at the intersections of reproductive health and things like transportation, child care, an economic justice model to ensure that the oppression that women of color have experienced in the reproductive rights movement ends, and instead we're working as partners. Women's voices are critical right now in the current state of our democracy and have been since the inception of this country. Women have played a very important role in politics and will continue to do so. The thing that makes me most proud about being a woman is the complexity of who I am. So in one hand, I'm a mother, I'm a sister. In some ways, I identify as a straight, biracial Latina, a woman of color. I identify as a professional. I identify as someone who's both brilliant and confused at the same time. Being a woman is beautiful in all of its complexities. Working at Planned Parenthood, absolutely without being overly dramatic, keeps me going every morning. I think all of us have felt this great depth of post-election depression and a sense that we're in a time of hopelessness, of very angry rhetoric, that we're in this time that is so confusing and quite dangerous for our communities. And being able to come to work every day at Planned Parenthood gives me such depth and personal and daily meaning that allows me to rise out of that a bit. It's a wonderful place to be, to think about the little d democracy and all of its options for women in particular who are emerging right now in this political environment with so much experience and passion to become involved. And we have an entire spectrum of the ways that that involvement can be captured and really utilized. So on one hand, it's as simple as reminding people to register to vote, reminding folks to get out, especially during midterm elections. That is such little effort that really goes a long way. And I think we learned that in the last presidential election. Then there's a next step, and that may be to attend a public rally or to go to a community meeting to support a group that you don't know much about. So depending on the appetite and the involvement level that folks are looking to really explore, the little d democracy of who we are as a country allows many entry points. And of course, I would be delighted to see all of our friends and family run for office. At the end of the day, this really is about who's representing our voices and where these issues are being taken up. We should not be discussing reproductive health care in our government public settings. Those are personal conversations that we should be having with our physicians, our faith leaders, with our family. We need to take government back and really be having those kinds of conversations that impact all of us.